Oklahoma Heart Hospital, where she performs nuclear stress testing. I hope I pronounced this right. I don't want to say anything naughty. Lipid,
apheresis.
what she said. Okay. And she also teaches CPR classes. She's been an American Heart Association CPR instructor for 26 years and enjoys teaching people the skills to help save others. So, Suzanne, the floor is yours.
Thanks. Okay, so this morning I'm going to do a demonstration for you on adult CPR, and if you'd like it, we can also do baby CPR. But as many of us, let's see, is my mic on? Okay. As many of us saw on Monday Night Football, unfortunately this fall, knowing CPR and being able to defibrillate somebody quickly saves lives. And they had a wonderful outcome from the horrible incident because the football player was treated immediately with CPR and then immediately defibrillated. So the sooner we get to somebody who's down, much better outcome. Okay, we want to get to people as soon as possible when they have an arrest. Oh, and I'm going to put, Sandy, can I put you to work?
Yep.
Hand one of those out, if you will, to everybody. So Sandy's handing out an American Heart Association pocket-sized card. This, on the front, has the steps for adult CPR. And on the back, it has warning signs of stroke as well as the warning signs for a heart attack, okay? So these are just kind of handy if you like it. I know a lot of people like handouts. And the nice thing about this, it folds up and is wallet sized. So you can use this and have one of those. You hope that you never need to use CPR, but being able to know that does save a life. The first thing that we want to do anytime we find somebody who is unresponsive or looks like they've fainted or they've passed out is we want to establish unresponsiveness, which means we just want to see if we can get any reaction from them. And usually that means maybe slapping a person's face, patting them, hey, you know, Mr. Blue, wake up. He doesn't wake up, we know that we've established unresponsiveness and you want to yell for help. The next thing I want to do is I want to look for any signs of breathing, so any rise and fall of the chest or any respiratory effort on that person's part. And then as far as teaching layperson CPR, so CPR that isn't targeted for healthcare professionals, at this point you send somebody to call 911 and then begin compressions. If you are comfortable checking for a carotid pulse, you can do that. But lots of people aren't comfortable checking for a carotid pulse. So if you don't feel comfortable with checking a carotid pulse, but you know that the person's not breathing, they're not responding, it's time to call 911, and yes, go ahead and start compressions, okay? Ideally, we would have this person on the ground, okay? I do it on the table because my knees really appreciate that at this point in life. If I was comfortable checking a pulse, I would want to check right in here on the carotid pulse, okay? And I'm going to have somebody call 911, and then I want to begin compressions. And I'm going to begin compressions on the lower half of the sternum. On my blue mannequin right here, it's pretty easy because he's got a nice black circle, but we want to be in the middle to lower half of the sternum. I want my body over this person, and basically, I want to push hard and push fast. Okay, that's the take-home message. I want to do 30 compressions in a row, and I want to do those at a depth of 2 to 2.5 inches, okay? And it does take a bit of strength, and that's why being on the ground is really going to help because your body then is over them. 28, 29, 30 compressions. Then I want to open the airway by moving their head back. This is called a head tilt chin lift. One hand on the forehead, one underneath the chin. I pinch an adult victim's nose. I would do the same for a kid, anybody over age 1. And then I give 2 breaths. And if he had lungs in him, you would see that rise and fall. Then I go right back into another 30 compressions. And the pace that we're trying to do, or the amount of compressions per minute we want to achieve, is 100 to 120 compressions per minute. So that's 2 compressions per second. So you are moving right along with some fast, deep compressions.
Do they still use staying alive?
You can. 28, 29, 30. Then I would give 2 more breaths. And I would keep doing that until I get help, or after 2 minutes I can recheck a pulse. If they have a pulse, I'm gonna stop, but more than likely they're gonna need transferred someplace, you're gonna need the ambulance, that kind of thing. Now, a wonderful thing came out from the American Heart Association in 2010. They found out that lots of people, okay, like us in the room, lay people, not healthcare providers, knew how to do CPR, but they were holding back in public situations on strangers and people they don't know because they didn't want to do what, right? They didn't want to breathe for the patient, for the person. So they came out with saying, if you don't want to breathe for somebody, just do hands-only CPR. By telling people, hey, they don't have a pulse, they don't respond, they're not breathing, call 911 and just do chest compressions until an ambulance arrives. As a nation, when we started doing that, out-of-hospital survival rates for cardiac arrest victims greatly increased because you took away the part they didn't want to do. People didn't want to breathe for other people. So if you just do compressions until an ambulance arrives, you are doing a lot to keep blood circulating, to keep the brain perfused. We want to get blood to the core organs of the body. The brains and the kidneys are the two that I really think of first. So the take-home message that's really important is if you're in a public place and you don't want to do breaths for a stranger, don't do them. Do compressions, do compressions, do compressions, okay? So I'll just start from the beginning on what I would do if I didn't want to give breaths, okay? If I'm at Walmart and the person in front of me goes down in the self-checkout line, I don't know this person. So I'm gonna say, hey, wake up. He doesn't wake up. I maybe pat his chest, try to see if I can get any response. He doesn't. I look and there's no breathing. Somebody else comes over and says to me, hey, what can I do? I'll say, you need to call 911. And then I'm just gonna get to this person's chest and I am gonna do nonstop compressions, okay? Until somebody comes, which if it's at Walmart in the city, there's gonna be an ambulance there very quickly. So do you see what I'm saying? Just doing compressions is still gonna save a life because you are circulating blood to the brain, okay? To the brain and to the core organs. Any questions for me on that? Okay, and you'll see on this card, they really want you to push fast and push hard. So like I said, you want to go at least 2 inches deep and you're trying to do 2 compressions a second, which is really fast. Why do we want to call the ambulance immediately? Because obviously they have more things they can do and because we want AEDs. Now, if you were here and we had an emergency situation, we do have an AED here and lots of places have AEDs that you probably don't even realize. Most schools are going to have AEDs, community centers, churches, gyms. If you work out in a gym, they better have an AED. If they don't have an AED, you need a new gym because it's just pretty much standard of care to have an AED. So what does that stand for? It's an automated external defibrillator. And there are certain horrible, bad, deadly rhythms that we can do CPR for an hour, but if you don't shock that rhythm, okay, we're not gonna change it for the person. So we can keep blood circulating, but we need that shock. So I want to just show you what you might do with an AED. They're super, super user-friendly, and the take-home message is just don't be afraid to get it out and see if it's needed. The first thing you do whenever you get an AED at the patient, at a victim's side, is turn it on and it tells you everything to do. What I like to do, this one is programmed as a trainer AED and it will walk us through everything. So I'm going to show you this, and I'm going to show you how the patches work on this Zoll brand. So this is over 20 years old and it's an older AED, but it's important to show because the premise of it is the same for any AED, no matter what brand it is, no matter who makes it. They all work on the idea that if you turn it on, it's going to walk you through everything in a 1, 2, 3 ABC sort of fashion. So I turn it on.
Apply pads to patient's bare chest.
So you may, I don't know if you heard it or not, but it said,
Pads connector next to flashing light.
he always wins. It says plug in the pads, and so all AEDs are going to be stocked with pads.
Apply pads, plug in connector.
And the machine will continue to say it until you do it. And the wonderful thing about all these brands They know you've never done this before, and they're gonna give you pictures. Okay, so one is gonna go up here on the
Apply pads. Plug in connector.
upper right and another on the lower left. So I'm gonna put those on the patient. So I'm gonna show you where I put them. And then I plug it
Apply
in.
pads. Insert connector firmly.
And it's very important that they just go on skin. So I might have a chemotherapy port right here. I would need to move the pad down just a little bit. It doesn't mean I don't put the pad on. I still want to put the pad on. I just need to move it out of the way of the chemo port.
Insert connector firmly.
Don't put it over a medication patch, an insulin pump. You don't want to put it over anything on the skin. And if the person's really, really hairy, usually these kits will have a razor in it so you can take off the little hair to put the pad on.
Connector firmly.
So I insert the connector.
Analyzing heart rhythm. Do not touch the patient.
So it's going to decide whether or not we need to shock the patient.
Shock advised. Charging. Stay clear of patient.
So I make sure that nobody's touching the patient.
Deliver shock now.
And then we
Press
literally
the
push the button.
Shock delivered.
It shocks him.
Paused.
We look to see if there's any response from the person. If there's no response from the person, I'm going to go right back into 2 more minutes of CPR. Now, this is connected and it's going to count that 2 minutes for me, and it will make a beep and it will say stop compressions, and then it will tell me to not touch the patient, and it will go all the way through that analysis process again of the rhythm, and then tell us if we need another shock. Okay? It will only shock a shockable rhythm, okay? Let's say we were at a pool party and this is somebody that was wet in a pool. I would want to dry the chest off and dry the person off as best I can and as quickly as I can. In all these scenarios, time is of an essence, so I want to quickly wipe their chest off, okay? That type of thing. If you were to use this on a pediatric patient, AEDs will have a second set of patches in them. One will be labeled adult, another will be labeled pediatric, and this says pedi on it, which means it's for children. If you're using a pediatric pad, patches, you don't have to worry about changing anything, because when we plug it in, based on what plug it is that goes in, it tells the machine, okay, this is a pediatric patient, so we're going to do a different current. Okay, so it takes all the thinking out for us. Has anybody here ever had to use an AED? No? Okay. You have? Okay.
Is there is it internally programmed how many times it will deliver a shock? In other words, it'll only do it 4 times and this is...
No, it'll keep going.
Okay.
It'll keep going. Now, if you are in a public setting and a paramedics come, they're going to, take this off and look at their own stuff. But if you're not getting out of the shockable rhythm and it keeps analyzing, it'll re-shock every 2 minutes. Yeah.
Until the battery runs down.
Until the battery runs down. There you go. And sometimes you do have to shock more than once. And if you get this out and the person doesn't need shocked, okay, so we buy a new set of patches. It's $75 or so, but the important thing is that we did get it out, because in those rare instances, we do want to be able to save a life, okay, and get to a person as quickly as possible. I want to show you the patches and the setup that the church has here at Wickline. So this AED is made by Zoll, and there's a lot of these out in public. I believe, Sandy, that this is the brand Mid-Dell Schools has, right?
I don't recall the green.
Oh, you don't? Okay. I thought I'd seen them, but this is, it's a pretty loud color, so these are pretty easy to see in public. The lid comes off of this, and then the patches are right here ready to go. And I am not going to open these, but I have a set that have expired that are open. So I want to show you what these look like. On the Zoll, it is a different setup. It isn't two separate patches, it's one very large integrated patch. So do you see that? And you take the sticky off and put it on the person so that takes a lot of imagination with Mr. Blue here. So the X is over the center of the sternum, okay? And then, just like on my trainer that I showed you, this goes in. And then if I turn this on, it has,
Unit okay. Adult dead.
so it already senses.
Stay calm. Check responsiveness. Call for help.
So
Stay calm. Check responsiveness.
he always
Call for
wins.
help.
So he's gonna talk you through everything, and because,
Open airway.
I'm gonna turn him off because he's kind of obnoxious. But if you notice, it's going through step by step and it's gonna tell you everything to do. And don't you love that the first thing it says is stay calm? It's like, stay calm. And then check it for responsiveness, check if they're breathing, call 911. When this is on and it tells you to shock the patient, there's a heart in the middle and the light would light up there and you would push that button. Then if the patient doesn't come back with that first shock, you're gonna go back to compressions. And the really fascinating thing about this Zoll setup is you're now gonna do the compressions on this sensor right here in the middle of their chest. And this gives real-time feedback. So his computerized automated voice will come back. If you are doing really, really bad compressions and you're not pressing very deep, it will come back with a message that says press harder. If I'm doing them super slowly, it will come back with a message that says push faster. It would also say if you were doing too fast, but I have never in 30 years of nursing seen somebody do more than 120 compressions per minute. It's really hard to get that accomplished. But that's really what's cool about this brand, Zoll. It gives you real-time feedback, okay? So that's what the patches look like for this setup. And this is what your whole thing looks like. This is actually set up so that the adult pad is attached in right now. So all you do on this package is you tear the packaging off because this is gonna stay connected. Does that make sense?
The pediatric one also?
The pediatric also has a plug-in.
Does it come packaged in with it so you could switch it out, or do you have to unbox it?
We have to take, yes, we have to take it out of the box. And then we would take the push part that goes in the machine, comes out, and there's a separate one here that goes in. Yes?
Are the pads the same connector used on different machines, so you could use one type of pad with a different machine? So they're machine unique.
Specific.
They're brand specific.
Okay. Well,
That
if
was
someone-
too logical.
Well, I understand. You don't have a pad for a particular machine. Can I use another pad for the,
No,
you would think they would make it so either or.
you would think.
But that makes sense. I'm sorry.
I mean, Samsung cell phones don't get to use iPhone and Apple
Yeah.
cell phone chargers. I know. We should have universal stuff, shouldn't we? But they didn't ask our opinion. So, any questions about the use of AEDs? Yes?
Is both of the
The
pads,
whites
the
out.
adult and the pediatric, are they both in that unit?
No. This, let me put my lid on there. Okay. This unit had the adult patches in it, and they say adult on them, and then over in the little cabinet that it's stored in, the pediatric pads were off to the side. It is much, much more likely that an adult will need to be defibrillated than a child, However, there are some rare instances when babies and children do need defibrillated. If you do not have further questions about the AED,
Actually, I've got one.
okay, hit me up.
I noticed that when you open the cabinet, they're alarmed, and most of the cabinets.
Yeah, it was
are.
obnoxious, wasn't it?
Well, no, my question is, when you shut it, did that turn the alarm off, or does the alarm stay on until somebody intercedes?
It stays on until the key turns the alarm off.
And where was the key?
The key is on the back of the cross that has the food in it, right next to it.
Okay, okay. So if you went somewhere and somebody asked you to, would you check the AED, then you would be fine to open it up, the alarm goes off, you can key it and then check it and put it back.
Because it is important, any facility that has an external defibrillator, it's important to know that your batteries are working and in date, and that your patches are in date. These do all have expiration dates on
The
them.
reason I ask is, I'm the safety officer for field day, and
Mhm.
we were at a school that had an AED,
Mhm.
and that was part of the required equipment that we had to have. And I would have preferred to take it out and have it close by, but I didn't know how the alarm system worked. I said, oh God, I'm gonna call the police, so I did not do that, but I'm more
Yeah.
comfortable now taking it out, realizing I can turn that
You
alarm
can turn the
off.
alarm off, yeah, because people do have to check it for keys and everything, yeah.
Couple things, I was the safety guy at Francis Tuttle Technology Center, and our AEDs, when you close the door, the alarm goes off.
Good.
Push button switch. And, also our AEDs on the readout that you can see through the door, but they were physios, by the way, physio
Mhm.
controls. You can see, it'll tell you if the battery's good, everything you need to know, you can see on the display, or if it's not good, it flashes and tells you the battery's low, or
Yeah, this has a green check mark that the battery is good, and it turns red when we need to change the batteries.
they have made them about as idiot-proof.
They have. Would you like me to review baby choking and baby CPR? Anybody want that? If you don't, that's fine. It is a little bit different than adult. Yes, do it? Okay.